Dr. Jody Dion Odom is with us, assistant professor, UAB. She's a professor of medicine in the Division of Infectious Diseases. And Dr. Jody, I know you're in high demand, so thanks for taking time to be with us.
I am. No problem. Thanks, Rick and Bubba. Apologies for being late. It's already been a crazy day.
No, look,
it's going to get worse, Doc.
So,
I think you're right.
Well, we're trying to get this proper balance of wisdom, common sense, but not hysteria, frenzy, chaos, and unnecessary fear.
I agree. No, I think that's just the right balance you want to strike.
Yeah, so help us with that. So some of the things we're going to ask you, first of all, have we been able to determine yet when we're talking about coronavirus or COVID-19, whichever one sounds hipper, that once someone gets it, like some of the other viruses, they are now immune?
I think it's a little early to be sure, but there are some studies that are showing that once you have COVID-19, you have antibodies that protect you from being reinfected. You know, we just started to see this virus in December, so we haven't had a year to know if you can be reinfected after a year. Not enough time has passed. But I just saw a new study where they were looking at a small study in China, and it looked like reinfection was not happening, but sort of stay tuned on that question. We're not sure yet.
Okay, so really not sure, but seeing some promising early indications.
Yeah, most of these viral infections, there are a lot of different flavors, but if you get a certain flavor, like if you get the chocolate ice cream flavor, you don't get infected by that same version again. So it should be the same for COVID-19. We're not positive about that yet.
Doc, if you get this virus, how long should someone expect to be sick? And is the number 80% still holding up, that 80% of the people have fairly mild symptoms?
It is. So to answer the first question, if people have symptoms, they usually have symptoms for about 2 weeks. And most of those are the people with the mild symptoms. Almost everyone has fever, cough, a deep cough, sometimes runny nose, occasionally diarrhea or a little bit of abdominal pain. But fever and respiratory issues are the major symptoms. If you had someone who was really sick and was in the hospital, their symptoms may last longer, so they may be sick for 4 or 6 weeks. But if you're, for the average person who gets this, I think 2 weeks is a good sense of how long it will take to feel better. The first week you usually feel worse than you do during the second week. And in terms of how many people are going to have mild symptoms, yes, the numbers you just gave are the right ones. It looks like about 80% of people will have mild symptoms, about 15% of people will have moderate symptoms, and about 5% are developing severe symptoms.
Do we have any indication that heat or warm weather is going to help us?
So this is $1 million question, and there's a lot of virologists trying to predict based on what we know about other coronaviruses. The coronavirus is an enveloped virus, so we know from other types that the envelope is actually, it doesn't like sunlight, it doesn't like heat, it doesn't like humidity. That's why a lot of these illnesses disappear in the summer. I don't think that people think it's actually going to totally disappear, but it's possible that the case counts could decrease as it gets warmer and more humid here in Alabama and across the country. It's, again, too early to be sure with this one. This is so new that it could be different than the other viruses have been in the past.
Yeah, be careful because there may be an influx of migration to Louisiana. So just be...
Doc, let me ask you this. A lot of people are asking. We lose a lot of people in this country every year to the flu.
We do.
Why the panic? Why the scare with this one now? Is it because of the curve of the infection rate or the unknown? Why are we going to such extremes for? And look, every life is precious, okay? But we're in a numbers game.
Right.
We've lost 69 people. Why are we doing this when we lose 20,000 a year to the flu?
Right. I think part of the reason is we understand the flu better. We've had flu every year, some variety of it for many years. So we understand how it's transmitted. We understand how to protect people from it. We have a relatively good vaccine, and we have treatment for people with flu. With COVID-19, we don't have those things yet. We don't have a perfect understanding of the epidemiology. We don't know how easy it is to transmit from people who don't have symptoms yet. and we don't have a vaccine or any treatments for it. They're working on it, but it's going to be some time until we have those ready. I think the comparison with flu makes sense in some ways. Flu is a disease that gives you fever and cough, and it's something that people can understand. But the mortality rate of COVID is much higher. So the mortality of flu is about 0.1%. So when you're talking about 30,000 deaths, that's reflecting the 0.1% mortality. And the mortality rate for COVID-19 is more like 1 to 2%. We don't have the exact number yet, but it's many times higher than the flu mortality is. So that's why we're worried.
And the H1N1 swine flu, we did declare a national state of emergency, but it didn't feel like this. And again, same answer. It's because we knew more about that than we do this.
Exactly. Well, I mean, when it first came out, we were still learning, but it was a different. The H1N1 was a different version of the same flu virus that we understood pretty well. So that's why this is different compared to that.
So the big answer is this is new. We don't know much about it, and we may find out when we do know about it. Okay. We can handle it. We can handle it, but the reason why we're taking extreme measures, which I tend to agree with, is because it's unknown, and we're trying to make sure that we don't overwhelm you guys and all the people in the medical industry so that people can get treatment at a rate we can handle it. I thought it was a great example that the lieutenant governor of Texas used. We wouldn't want 10,000 people at a time to break their leg,
right?
Because that would overwhelm us as well.
Doc, let me ask you this on the bigger picture. We've had pandemics before throughout history, and some of them have done great damage to the population. Mm-hmm. But why this one and why now? Is it just kind of the law of averages? You're going to get one that mutates and gets out, or why are we having this now? Why didn't we have it last year or next year?
Yeah, I mean, in the world of infectious disease, there's always people who are talking about emergency preparedness. And this is the thing that they're always worried about. We know that there's viruses often circulating in other types of, in birds, in bats, and things that come in contact with humans. So from the viral perspective, that's where the virus can be introduced from an animal host into a human host. And as for when it happens, you can't predict when. It can happen anytime. And since we live in a global environment now, there's so many people traveling between borders and taking flights and going to places that they didn't go to 100 years ago, the possibilities for this virus to spread quickly are much worse than they were in the past.
All right,
so that's part of the concern.
Here's the question. I know you're in high demand, but we never got to you giving advice on what people needed to do, and we need to go to a hard break. Is there any way you could talk a few more minutes after this break, or is that impossible?
Yes, no problem. I'm happy to, as much time as you need. I want to answer your question.
Okay, thank you, Don. So when we come back, now we're going to talk about day-to-day life, as we're continuing to do the research, you guys are doing your job.
You give us some great info, by the way.
Yeah, what all we need to be doing in our everyday lives during this state of emergency and the pandemic. So we'll cover that when we get back, so all of you kind of be ready to take that information. And again, calm is part of this, just common sense, wisdom, and we'll get through this like we have others in the past. This one we don't know as much about as she has made clear, and that's the reason why we're taking extreme measures, because if you don't know something, it's better to over-prepare than under-prepare, and that's all right. So bottom of the hour, we'll talk more right after this with Dr. Jody Dion Odom.
Rick and Bubba.
And we'll get to some of the questions about the misinformation, but since we won't get to the end of the break again and never get to this, let's talk about quickly, Professor, about the people right now that are saying, all right, we're getting out of big groups, we're staying in our homes if as much as we can. What are the things that we need to be doing while all of the people in the medical field continue to try to find answers and get us the information? In the meantime, we all should be doing what?
I think the way you should think about this is that we know we have cases here in Alabama and every state, that there's a single state that doesn't have cases. So assume that this is in your community and take measures to protect yourself and protect your family. Really, the people who are most at risk are anyone above 60 and people with underlying medical conditions. We really want to try to prevent those people in our community and our families from coming in contact with this virus. So that means not being around anyone who's sick, not going in public places where you could come in contact with someone who you don't know has COVID and then bring it back to your house or the people that you love. That's what you want to prevent.
So the hand washing also, right? Hand washing is big.
Yeah, hand washing, use any surface that you're touching frequently, like your phone, like your remote control. You want to make sure that you sanitize those. Hand washing and not touching your face are the two principles right now of not getting coronavirus. But avoiding sick people is probably the even more important step.
We've decided touching our face is out because every time I hear somebody say, don't touch your face, my eyes start itching.
I can't stop doing it.
I have to say, it is almost impossible not to touch your face. I think that you're right.
It's like somebody yawning in the room.
Yeah. I know. But if you remind yourself as you're doing it not to do it as often, that will help. The reason touching your face is important is because this is a droplet virus that lives on the table. So if you touch the table, you have the virus on your hand, and the way it gets to you is from you touching your eye, then it gets in through your eye. So that's why it's important, but it's hard to put in action.
My wife and I, we had the invisible fence, for our dogs, so we've put those on each other. And every time one of us touches our face, we shock each other.
Anything to help.
Perfect.
And it is working.
Dr. Jody, let me ask you this, too, because we're getting a lot of questions about this. Is this a natural progression of a virus that is mutating? There's rumors out there that it has been edited, that it could be weaponized. What medically do we know about it right now?
So viruses are always changing. That's what viruses do and how they spread. But there's no weaponization of this virus. This is a virus that we think was living in bats or living in these animals called pangolins in China. And some people in a market where they sell dead and live animals came in contact with the virus and it started to infect humans. So there's no weaponization. If you're hearing those rumors are not true.
Including, which is your field of expertise, including HIV being part of it, that somehow we found some connection that someone had added, parts of the HIV virus, all that false?
Yeah, the virologists have already done PCR, so that means they've sequenced what this virus is, and none of this virus is the HIV virus. So there's no association. I think maybe some people are hearing that one of the drugs that we're trying to use to treat COVID-19 is also a drug that we use to treat HIV patients. So maybe that's where that concern is coming from. But there's no link at all between COVID and HIV virus.
Dr. Jody, tell us this. From the time that we first heard about this, and it was it was in December.
Yeah.
To now, it takes time to find out what it is, to isolate it, to get a test together, to get a protocol, to read the test.
Yeah.
We hear some people like that this has been a total failure of our politics and our medical community, but it seems to me that this is moving extremely fast considering we had no idea what this was 90 days ago.
I think both of the points are true. I think that we had the virus isolated within 9 days of having the first report from China about what this was when it was made public. So that's incredibly fast. We're working on treatments and vaccines to try to treat this right now, immediately, to start within the next several weeks. That's incredibly fast. I think the problem is, and I'm receiving calls from patients and people in the community too, is that given the level of concern, people with symptoms are looking for testing. They want to know, is COVID in my house? Is COVID in my wife? Is there COVID in my child? And that's where the disconnect has been. Many people looking for testing, and there's just not capacity enough yet in our country for everyone who wants to be tested to be tested. Everyone's working on it, and I think we'll get there. But we're in that in-between period where we don't have as much capacity as we would like.
So let's deal with that, because we don't want to overwhelm what we already have. So will you please clarify on those who need to be tested? Because what we don't want is for people who really have not met the criteria to be tested to bog down the system. Who needs to be tested?
So the focus for people for testing right now should be people who have symptoms. So we're doing testing on the people in the hospital who are the sickest and the people who have pneumonia or breathing problems who are in the hospital, in the emergency room, not breathing well. Those are our priorities. Anyone who is not symptomatic, who thinks they maybe came in contact with someone with COVID-19, can self-isolate where they don't come in contact with other people, but they don't need testing right now if they don't have symptoms. So that's going to really help if those people don't go to the emergency room at this point.
Correct. So if I think I've come in contact, how long should I isolate myself without contact with other people?
The normal incubation period for this virus is 5 days. So after 4 to 5 days from when you had contact with that person, you should start to feel symptoms. It is as long as 14 days, though. So what we're recommending is a 14-day self-isolation period where you don't come in contact, just to watch yourself to see if those symptoms develop.
In our society, how long do you think this is going to go on, Doc? What will it take us to get back to quasi-normal?
Yeah, well, the only thing we can do is look at what's happened in other countries. So you can look at the pattern in China, you can look at the pattern in South Korea, and you can see what their curve looks like. I would say we're looking at a couple of months. This is not going to be done in 5 days or 15 days. We should be prepared for changes to our normal daily routine. We're the middle of March, so at least into the middle of May. And then we'll see if the warming of the temperature has any impact on this virus.
All right, let's talk about day-to-day life. And honestly, because, like, for instance, right now, I'll just tell you straight up, we're hungry. Okay? And so normally our routine is we all get to the office and somebody makes a breakfast run and goes and gets breakfast for everyone.
Yep.
And we haven't done that. And sometimes you're going to run out of stuff and you need to go to the grocery store. I mean, you're going to, especially if you're saying 2 months.
Right.
So, the toilet paper craze was a little overdone. I wish everybody had worked together as a community a little better on that and not become hoarders. Let's have enough for everyone. But, which, by the way, this is what socialism looks like when you go to the store and just get what they have. I watched a poor guy walking out with 3 packs of napkins. I said, well, we do what we can. But anyway, so where's the level-headedness on, all right, we want breakfast right now. What should we
do not do? What's the numbers? How do we play the odds in this?
I mean, you have to eat, right? So people are still recommended to go to the grocery store to get food for their family. You want to make sure the person going to the store is not the one who has symptoms, and you want to limit, when you're in the grocery store, any contact with anyone while you're there. So try to touch as few things as possible. If someone is coughing, put yourself far away from them. But in terms of restaurants, a lot of restaurants have great options now for just order and they deliver. So if you can have the food delivered to you, then you don't have to worry about coming in contact with a bunch of people in booths behind you and in front of you who could be sick.
Well, what about the people fixing the food?
It's a good question. So they have been told that if they have symptoms, they shouldn't present to work. That's sort of one of the public health tenets for the employers who run these organizations, is their workers who prepare food shouldn't come to work sick. Every place is going to have a different individual policy. I can't speak to all of them, but you could call them before you order the food and ask what their policy is and base your decision on that. That'd be a reasonable option.
Doc, I guess what I'm saying, too, if you digest the virus, will you get it, or does it have to go in your respiratory system? Will stomach acid kill it?
If you're getting hot food that's been prepared, that hot food is the food that's been cooked is going to kill any virus that's on it. The concern is someone who touches it afterwards. So, for example, if they put it in a to-go basket for you, someone holding that basket, if they cough on that basket, you could pick up the basket and get sick. You follow me? It's not the food itself.
I got you, yeah.
It's more the packaging.
So one last thing that we'll let you go.
Yep.
So we have a story here. And you mentioned this, but I just want to get some details. That we've got about 35 companies and academic institutions, I'm sure you're involved in this, trying to get a vaccine ready. And they said at least 4 have been tested on animals, and they think that they might be ready for human trials in April, but the government is reporting that a patient is going to get an experimental dose today. Is that accurate or not accurate?
So there is the NIH. Dr. Fauci has been doing a lot of press lately, so people may have seen him. He's really a leader in our field of infectious disease. They have advanced quickly the ability to test these vaccines. Fortunately, we had a vaccine that was already in production, so people have been working it already. So that is a really good candidate to start to give to a very small number of people to look at safety and efficacy. And yes, I also heard the report that this vaccine is going to start to be tested very soon. I'm not sure today, but I heard it will be tested very soon.
So who do you think should go get breakfast for us in here?
Well, that's a good question.
Yeah, no. Thank you
I
very
can
much.
answer that for you.
Dr. Jody, thank you so much.
No problem. I'm happy to help. Thanks for the question.
Thanks for your expertise and all of you in the medical field. And I'm thankful that we live in a country that still has the level of research available that we have in this country. And appreciate
we're working hard to keep people healthy. We're doing the best we can. It's a stress system, but thank you for getting the word out.
Yes, ma'am. Thanks for calling us. We'll be back 14 minutes to the top of the hour.
Rick and Bubba, Rick and Bubba.